Imagine you're talking with someone you love when their coffee cup suddenly slips from one hand. They try to speak, but their words sound strange. Then you notice that one side of their face is beginning to droop. They say they feel fine and want to wait. But inside their brain, blood flow may already be blocked, and brain cells may be dying. A stroke can happen without warning. It can take away a person's ability to speak, walk, remember, or live independently. It can cause permanent disability or death. And when a stroke happens, every minute matters. The faster treatment begins, the greater the chance of limiting brain damage and improving recovery. In this video, you'll learn how to recognize a stroke using BEFAST, what happens inside the brain, what to do immediately, what you should never do, and how to reduce your risk in the future. Remembering this information could help you save someone's brain and possibly their life. One of the easiest ways to remember the major warning signs of a stroke is BEFAST. Each letter represents something important to check. The key word is sudden. A sudden change in balance, vision, facial movement, arm strength, or speech should never be ignored. B stands for balance loss. Does the person suddenly feel dizzy? Are they having trouble standing, walking, or coordinating their movements? They may stumble, lean toward one side, or need to hold on to something for support. Sudden loss of balance can be an important warning sign, especially when it appears with another symptom. E stands for eye or vision changes. A person having a stroke may suddenly experience blurred vision, double vision, or loss of sight in one or both eyes. They may describe part of their visual field as dark, missing, or covered by a curtain. These changes can appear without pain and may be easy to dismiss. F stands for face drooping. Ask the person to smile. Does one side of the face appear lower than the other? Is the smile uneven? One side of the face may feel numb or difficult to control. The change may be obvious, but sometimes it is very subtle. A stands for arm weakness. Ask the person to raise both arms and keep them there. Does one arm drift downward? Are they unable to lift one arm fully? Do they suddenly feel weakness or numbness on one side of the body? The weakness may also affect the hand or leg on the same side. S stands for speech difficulty. Ask the person to repeat a simple sentence. Are their words slurred, confused, or difficult to understand? Do they use the wrong words, struggle to form a sentence, or appear unable to understand what you are saying? A person may be fully awake but suddenly unable to communicate normally. T stands for time to call emergency services. If you notice even one sudden warning sign, call immediately. In the United States, call 911. In much of Europe, call 112. Otherwise, use your local emergency number. Do not wait for more symptoms to appear. Do not wait to see if the person begins to feel better. Time lost is brain lost. Other possible stroke symptoms include sudden confusion, numbness or weakness in the leg, difficulty understanding others, or a severe headache with no known cause. A sudden, extremely painful headache may be particularly concerning when it is accompanied by vomiting, weakness, confusion, or loss of consciousness. Sometimes stroke-like symptoms disappear after a few minutes. This may be a transient ischemic attack, often called a TIA or mini-stroke. But temporary symptoms are not safe symptoms. A TIA can be a warning that a larger stroke may follow. Even if the person appears completely normal again, they still need urgent medical assessment. A stroke occurs when part of the brain loses its normal blood supply. The most common type is an ischemic stroke. This happens when a blood clot blocks an artery carrying oxygen-rich blood to the brain. The clot may form inside an artery narrowed by plaque, or it may travel from another part of the body. For example, an irregular heart rhythm called atrial fibrillation can allow a clot to form in the heart and travel toward the brain. Once an artery becomes blocked, the affected brain tissue begins losing oxygen and nutrients. A hemorrhagic stroke is different. It happens when a blood vessel in or around the brain leaks or bursts. The escaping blood damages nearby tissue and increases pressure inside the skull. Both ischemic and hemorrhagic strokes are emergencies, but they require different treatments. That is why no one should attempt to diagnose or treat a suspected stroke at home. High blood pressure is one of the most important modifiable risk factors for stroke. Other risk factors include smoking, diabetes, high cholesterol, atrial fibrillation, obesity, physical inactivity, excessive alcohol use, age, and family history. Having experienced a previous stroke, or TIA, also increases the risk of another stroke. Some risks cannot be changed, but many can be managed with medical care and healthier daily habits. If you suspect a stroke, call emergency services immediately. Tell the dispatcher that you think the person may be having a stroke. Note the exact time the symptoms first appeared, or the last time the person was known to be normal. This information can help the medical team decide which treatments may be appropriate. Keep the person safe and comfortable. Help them sit or lie down if they feel weak or unsteady. Loosen restrictive clothing and stay with them while waiting for the ambulance. Continue watching their responsiveness and breathing. If they become unresponsive and are not breathing normally, begin CPR and follow the emergency dispatcher's instructions. Do not drive the person to the hospital yourself unless emergency services tell you there is no safer alternative. An ambulance team can begin assessment, alert the hospital, and respond if the person's condition suddenly worsens. Do not give the person food or drink. A stroke can interfere with swallowing and create a risk of choking. Do not give aspirin. Although aspirin may help with some clot-related conditions, it can make bleeding worse if the stroke was caused by a ruptured blood vessel. Do not give medication unless directed by emergency professionals. Do not let the person go to sleep to see whether the symptoms improve. And do not delay the call while searching online or contacting family members. Call emergency services first. At the hospital, doctors may use brain imaging, such as a CT scan, to determine whether the stroke was caused by a blockage or bleeding. For some ischemic strokes, clot-dissolving medicine may be used when the patient meets specific medical and timing requirements. In certain cases involving a large blocked artery, doctors may perform a procedure called mechanical thrombectomy to physically remove the clot. Treatment for a hemorrhagic stroke may focus on controlling bleeding, reducing pressure inside the skull, managing blood pressure, or performing surgery when necessary. The correct treatment depends on the type of stroke, its location, its severity, the person's health, and how much time has passed. After emergency treatment, recovery may involve physical therapy, occupational therapy, speech and language therapy, psychological support, and medication to reduce the risk of another stroke. Recovery is different for every person. Some improve quickly, while others may need months or years of rehabilitation. Not every stroke can be prevented, but many important risk factors can be managed. Know your blood pressure and work with a healthcare professional to keep it under control. Monitor cholesterol and blood sugar, and take prescribed medication exactly as directed. If you have atrial fibrillation or another heart condition, follow your treatment plan carefully. Avoid smoking, limit excessive alcohol use, stay physically active at a level that is safe for you, and choose more vegetables, fruits, whole grains, beans, nuts, and minimally processed foods. Maintain regular health checks, especially if you have already experienced a TIA or stroke. And remember, BEFAST, balance loss, eye or vision changes, face drooping, arm weakness, speech difficulty, time to call emergency services. Even one sudden warning sign is enough to act. Do not wait for it to disappear. Share this video with someone you care about and subscribe to Dr. Baro Body Signals for clear practical health education. Spot it. Act fast. Stay safe.